All right. So Project Teach is a community-based rehabilitation program established initially by the local government of Mandaluyong City and the Rehabilitation and Empowerment of Adults and Children with Handicap Foundation, which I represent. So as a community-based rehabilitation program, our objective is to provide rehabilitation, educational, medical, and related services for a youth with developmental conditions who reside in depressed communities. And what makes Project Teach unique is how we have empowered the community, particularly the parents and the family of our beneficiaries, in order for them to be able to participate in the health and rehabilitation process of the students. In Project Teach, we were able to streamline the different programs and services of participating private and public agencies. To name a few, we have the Department of Education, Department of Social Welfare and Development, the Public Information Office, the Persons with Disabilities Affairs Division, City Health Office, the Liga ng Barangay or the League of Barangays, which is the smallest unit of government in the Philippines, the daycare centers, manpower agency. We also have friends from the Mandaluyong City Center, Mandaluyong Medical Hospital, and from the private sector we have the Hands of Mercy, Parent Association of Children with Disabilities of Mandaluyong. We also are supported by the Parents Teachers Association of Mandaluyong. So numerous training activities are rendered to parents. Initially, there will be lectures and workshops for them to learn the basic knowledge and skills needed to carry out therapy procedures and educational strategies for their children. Once the parents have acquired the basic skills, the staff then encourage them to what we call co-handle the children. And as they become more proficient, the role of the staff becomes more supervisory in nature. So this way, the parents assume a more active role in the care and education of their children. So once the parents have already become more confident, they can even be assigned to help the children of other parents who are newly diagnosed or detected. Of course, training has to be continuous. So after every session with the child, the staff give one-on-one feedback to the parents for them to learn which points they were able to do effectively and how they can further improve their methods. Training also occurs at the professional level. We have specialist developmental pediatricians who come to Project Teach. All over the country, we have around only 50 plus of them. And we're fortunate that we have at least 4 of them coming over to Project Teach once a month. But this is still not enough, considering the number of kids who come to Mandaluyong City for help. For this reason, these specialists have actually trained the government's doctors assigned in the different health centers to do initial screening. Now, in order to be able to detect all the kids who are at risk of having developmental conditions, we also trained professionals and community helpers from different organizations and agencies. For example, all the public school teachers, the social workers, the barangay health workers or community health workers, along with volunteers from different civic organizations, have undergone training on the detection of children who are at risk of having developmental conditions. And we explain to them that all it takes is for them to suspect that there is something unusual about the child for them to refer the child and the child's family to Project Teach for the confirmation of a diagnosis, if any, and for the child to receive the intervention that he or she needs. Currently, we have more than 600 children benefiting from the program, and apart from the impact that their development has made on their families, because now the parents will have, let's say, more time to engage in productive work outside taking care of their children. Not to say that it's not productive and important. The community has become more sensitive and aware of people with disabilities as a whole. So the community is now more accepting and supporting of them. And there are numerous stories and testimonials coming from the parents of our children saying that their neighbors are now more accepting of them. And even the language has improved. Instead of calling them, by derogatory names, now they know how to refer to them more sensitively. We also have friends from the community who are not necessarily related to a child with special needs who have developed interest in helping and therefore volunteered to have themselves trained and become crew to help out in the rendering of therapy and educational services. So also, the community, of course, takes pride in the project. The crew members and the family members being members of that community as well, of course, have this renewed sense of purpose and esteem, knowing that they have contributed directly to not just the implementation, but even in the conceptualization of the project. And it's because of this sense of ownership that I guess the community has embraced the program, and because of this, they back the project fully. Project Teach, thankfully, has become assured of its sustainability because the local government has passed necessary ordinances and laws to make it a permanent project. Our vision for Project Teach is for it to be replicated in as many areas as possible here in the Philippines and perhaps even internationally, especially in communities where services for people with disabilities are limited. Now we already have friends from our neighboring countries coming over to study our model, and this gives us a lot of joy knowing that Project Teach now has the potential of reaching out to PWDs beyond Mandaluyong City. And it is also our vision to eventually further expand the services and programs being offered. The mayor has already discussed the possibility of setting up like homes for children with disabilities who have already been abandoned by their families, for instance, so that they will be assured of lifelong care and support by the city. Project Teach is a result of good collaboration between different agencies and organizations from both the private and public sector. So it is possible to come up with good results. We also are very grateful to all the people who have supported Project Teach, especially during its inception. We received initial grants from the World Bank and the Australian government, and we were able to sustain the project because of the local government's commitment to absorb it. We are very optimistic that in the future, Project Teach will be able to reach out to more people with disabilities, not just here in Mandaluyong, but also all over the Philippines and even internationally. With the UN PSA, we know that many doors will be opened, not just for Project Teach, but for the PWD sector as a whole. We hope that this recognition will bring the spotlight to this population that has been rendered marginalized for so many years already. So it is high time that we now pull all our efforts and our resources to help them achieve their optimum potential and to become integrated members of society.